this second video will be focusing on the Rhesus blood group system. This blood group system was first discovered by Karl Landsteiner in the year 1940. He first discovered this antigen on the surface of the red blood cell of a Rhesus monkey. There comes the name the Rhesus blood group system. So it's one of the most important blood group system because this will help us, it will help partners to prevent the hemolytic disease of newborn babies. The Rhesus blood group system consists about 47 antigens, which we'll be looking at the most common one, which is the D antigen on the red blood cell surface. So this D antigen is divided into two based on the presence of this antigen or absence of this antigen. So any blood cell, red blood cell, that we see this antigen on its surface, we say that the person is Rhesus positive. Anyone that lacks this antigen, we say that the person is Rhesus negative. Just as you can see here, in this red blood cell here, you see the presence of this antigen. Antigens are attached on the surface of this blood cell. So we say that the person is Rhesus positive because of the presence of this antigen. So but here you see there is no antigen attached on the surface of this red blood cell, which means that the person is Rhesus negative. Look at different blood group systems. Our 4 blood group system is modified here into 8 blood group system based on the positive and negative Rhesus factors. So if you look at it, we have here, as I said earlier in our previous video, that O negative is a universal donor. O negative can give blood to all blood groups, but it can only receive from O negative alone. O positive can give blood to O positive, OA positive, B positive, and AB positive. Just note that O positive can give blood to all positives, but it can only receive blood from O negative and O positive. A negative can give blood to A negative, A positive, AB negative, and the AB positive. But it can only receive blood from where? O negative and A negative. Look at the A positive. A positive can only give blood to A positive and the AB positive. It can only donate to these two alone, but it can only receive blood from O negative, O positive, A negative, and the A positive. Look at B negative here. B negative can give blood to B negative, B positive, AB positive, and negative. But it can only receive blood from O negative and the B negative. B positive can donate blood only to B positive and AB positive. Just so you see similarities here and here. So they give blood the same way. And it can only receive blood from O negative and the O positive, and also B negative and B positive. AB negative can give blood only to, look at it, AB negative can give blood to only to AB negative and AB positive. And it can only receive blood, from B negative, A negative, B negative, and the AB negative. So you look at it, can receive blood to O negative, A negative, B negative, and the AB negative. So you see that it can receive blood from all the negatives. But here, the AB positive can only donate blood to AB positive. The AB positive can only donate blood to AB positive, but it can receive blood from all blood groups. So here you see that we have O negative as a universal donor, and we have AB positive as a universal recipient. Note it, AB positive, a universal recipient, and we have O negative as a universal donor. Erythroblastosis fetalis. This is another name that is given to hemolytic disease of newborn babies. This always occurs if a mother with Rhesus negative has a fetus with Rhesus positive. The mother will eventually develop a Rhesus negative antibodies that will fight or work against the fetus Rhesus positive. So during this time, you see that these antibodies will react with the subsequent Rhesus positive, which will lead to what happened earlier, just like during hemolysis, the bursting of red blood cells. It is a very bad issue. So it's always advisable that people should be able to observe and identify their blood group system before making choice of their life partners. Now look at how it works here. During pregnancy, this is the mother's womb. The mother is Rhesus negative, and the baby inherited this Rhesus positive from the father. What will happen? You will see that this Rhesus negative and this one is Rhesus positive. When the child has detached itself from the mother, it has developed its own circulatory system. The child will start to transport blood out of this womb into the mother's body. It will distribute blood out of this womb into the mother's body, and this blood that the child gives will produce its own antibodies. These antibodies will fight against that of the mother. Let me come one more. Look at the mother is Rhesus negative. If a mother is Rhesus negative and the child is Rhesus positive, it will result in that this Rhesus positive is as a result of that. The child inherited this from the father. What will be the cause? That during pregnancy, labor or miscarriage might occur because hemolysis will occur, bursting of red blood cell will occur. So if rupture occurs in the womb, during this time, the child separates itself from the circulation of the mother and have its own. Remember that during rupture of the placenta, that the child will detach itself. It will start to live some independent life. So during this time, the fetus blood that contains Rhesus positive, will eventually meet the serum of the blood of the mother. It will meet that of the mother. And when this occurs, this one will form antibodies. It will form its own antibody. And these antibodies will be countering with the one that the Rhesus negative has. So the production of these antibodies will bring about hemolysis. It will bring about anemia. Because antigen-antibody reaction will result that the child miscarriage might even occur. So it's always advisable for people to observe these processes in case if we have such issue. These are steps that we can take in order to avoid this. Maybe we can be able to take injections or take Rhesus injections that can fight against the fetus antigens. So at times you see that a shot of these antibodies can be given to mother 72 hours before and after delivery. Some people, they do take blood transfusion where they will try to wipe away the blood of the baby so that it can be able to refresh. But prevention is always better than cure. Thank you. In your assignment, you will be able to see a lot of past questions that are related to this topic. I encourage you to solve them and submit before deadline so that we can be able to ascertain our level of performance.